think we'll get started. Welcome, everyone. So this is a session of the Global Speaker Series on post-secondary student mental health research. This event is a continuation of a virtual event series developed in part of our global research network. The founding partners are the University of Toronto, King's College London, National Taiwan University, and the University of Sydney. It was funded by a Connaught Global Challenge Award at the University of Toronto. The goal of this speaker series is to provide the opportunity for faculty, staff, students at all levels to present their research, interest, and expertise in the interdisciplinary field of post-secondary student mental health research. Additionally, we want to provide knowledge generation, dissemination, and expansion in the field of global student mental health. Please note that a feedback form will be shared following the session. We invite all attendees to complete the form and support future planning of this global speaker series. It is my pleasure to introduce Le-Tien, who is our moderator for today. She is one of the co-founders of the Canadian Social Prescribing Student Collective, a national student movement with over 200 students across Canada. She is an active advocate for social prescribing and is currently completing her PhD in health policy at McMaster University, which is my alma mater. Awesome. And so welcome, Le-Tien.
Thank you so much, Kristen. Welcome, everyone. Today's session will be a presentation from Dr. Nicole D'Souza from the Dalai Lama School of Public Health and Dr. Daniel Hayes from University College London. Both will be discussing the topic of opportunities for social prescribing on post-secondary campuses. I'd like to invite Nicole to turn on her camera. Dr. Nicole D'Souza is a postdoctoral fellow at the Dalai Lama School of Public Health and an embedded researcher at JAC.org with over a decade of experience in applied mental health research focused on children and youth. She specializes in decolonial community-based approaches to mental health services that address the social determinants of health. She is engaged in research on social prescribing for young people in community and school settings, aiming to improve access to holistic mental health support by integrating health and social care. And Dr. Daniel Hayes is a senior research fellow within the Social Biobehavioral Research Group at UCL. Daniel studied his PhD at UCL and has completed postdoctoral work at both King's College London and UCL. His research focuses on how we can enhance and improve child and youth mental health by drawing on social, cultural, and community support, such as community engagement, arts and cultural activities, and the role of schools in supporting mental health, as well as how these types of support can be integrated into mental health services via social prescribing.
Thank you, Le-Tien. I guess we can get started with the presentation. For today's presentation, we wanted to do a sort of deep dive into social prescribing and what that means for the post-secondary context. The objectives of this presentation are to introduce social prescribing as a holistic mental health pathway, and describe how it could support student mental health needs through non-clinical community-based resources. We'll also introduce a new feasibility study that we are about to launch, looking at how social prescribing could potentially be integrated onto post-secondary settings. And my colleague Dan Hayes will describe some of the preliminary results of a joint study highlighting the perspectives and awareness of students on social prescribing. So I will go first, and then Dan will continue with some of the results of the study. Okay, so We know that in terms of the Canadian landscape for post-secondary student mental health, we are seeing quite a few things. Starting a journey as a student is an exciting time. Students are leaving home potentially for the first time. They're embarking on their professional careers. They might also be juggling work. So it is a new opportunity for students to harness the momentum of their careers and also form new relationships. We also know that this is particularly also a vulnerable time in their lives. Many students are leaving home for the first time. They're learning to manage the responsibilities of living independently, of juggling schoolwork and working. And then for international students, it's also managing and adapting to a new country context. So this transition phase is intersecting at a critical developmental stage for young people, where we often also see mental health issues or problems emerge. As you see on my screen, these are results from a large national survey study that looked at Canadian post-secondary students and some of the mental health challenges that they face. And we see that some of the issues that students are facing include being stressed or overwhelmed, experiencing anxiety and depression, and also this feeling of social isolation and loneliness. And we know that since the COVID-19 pandemic, we've seen that these issues have worsened. We've seen that students are experiencing increased loneliness and isolation, as well as an array of other issues related to the social determinants of health, including financial insecurity, housing instability, food insecurity. And these are all all of the challenges that students are facing that underscore some of the ways in which we need to start addressing these challenges. These challenges are impacting both their academic and personal success, and university campuses or post-secondary and college campuses are looking for ways in which they can address these issues. However, despite these issues, we also see that there are multiple barriers to treatment for post-secondary students. This includes time constraints. Students are learning to juggle multiple demands from their school schedules. Some of them are also working. A lot of students may not feel that the treatments that are offered on campuses are meeting their needs, financial constraints, long wait times. So from the moment a student may walk into a health and wellness center and be assessed to then being matched with a health professional based on their needs, we see that students are left in this sort of transitional space and waiting period. For some students, the issues of stigma and cultural barriers of services may impede them for harnessing some of the initiatives or services on campus. And for other students, engagement in the university life itself or perceptions of the university not being a supportive space can impact their experiences of accessing treatments or care. So this is all to say that given this sort of landscape, we see that a lot of post-secondary institutions within Canada have slowly moved towards a socio-ecological approach for mental health promotion. This shifts away from just addressing the individual and the individual issues that are being presented to looking at how the individual is embedded in their environment, looking at the interpersonal, looking at how a student is within the campus community, within the larger geographic communities that they belong to, and how all of these levels interact to impact their outcomes. We are seeing campuses moving away from just individual level solutions. So that would be maybe counseling services or talk therapy, to providing more stepped care solutions, depending on the range and array of needs of students, and harnessing a lot of upstream approaches that not only address the mental health directly of the student, but also address the social and environmental determinants of health. And this means looking at a campus or institutional approach to multiple levels of influence that students are facing on campuses. So this really means adopting a healthy university model, and this is rooted in the Ottawa Charter, where universities and post-secondary campuses are promoting an institutional-wide health promotion approach, not just looking at health centers or the health sector, but looking at how different parts of campus life or the microcosm of university life can interact to provide a scaffolding for students. For campuses, this may include approaching and adopting health promotion frameworks like the Okanagan Charter, frameworks from the Canadian Association of College and University Students' Mental Health, and also the national standards. So we're seeing this movement towards health promotion in a holistic way, encompassing multiple levels, different sectors coming together to address student mental health. So what does that have to do with social prescribing? Well, in order to make that connection, I guess a good place to start would be just to describe what social prescribing is. Social prescribing is essentially a health promotion pathway where individuals with clinical or non-clinical issues are referred to non-clinical community services or social services. This could include engagement with art programs, social clubs, engagement with things in the community such as volunteering, and all of this is with the goal of improving their well-being and health. In recent years, social prescribing has gained traction in Canada, and this has emerged with the establishment of the Institute, the Canadian Institute for Social Prescribing, and also initiatives from Ontario Alliance for Healthier Communities, which have established social prescribing initiatives across the country. And these are to address multiple different problems from aging in place with elderly populations, looking at caregivers' health, looking at children and young people in community settings, and also looking at how this can be harnessed now within a post-secondary setting. So to describe social prescribing, we're thinking about this at a system level, and we're thinking about this in terms of a pathway. So we know when we're saying that individuals are connected to non-clinical, social, and cultural resources, this may be happening. This probably is already happening in many different contexts, but what social prescribing is this pathway. So how can we integrate this pathway, which usually starts with identifying and referring people to a social, a link worker or a navigator. So what this includes is in a primary care setting, you may present to your doctor's office. You may discuss some of the issues that you're facing, including health, or it could be related to your mental health, to issues related to the social determinants of health and some of those challenges. And then what happens is that your primary health provider then connects you to someone called a link worker or a community navigator, which then is this idea of sitting down with the individual or with the patient and co-constructing a path of connections to resources that could be available in their communities. It could be available on campus, and allowing the individual to move the conversation and starting point from what's the matter with you to what matters to you. So the link worker is based on a strengths-based approach, a relational approach, and really centers the individual for what is important in their lives and how they can mobilize those supports to help that individual. It can occur in a spectrum of ways. It could be something such as signposting, which is just indicating to the individual the types of services or initiatives that are available to them, showing them what that would look like. Or then it also could also be seen through accompaniment. So then the link worker, community navigator accompanies the individual to try out these different supports to then sit down and see if that works for them. So the social prescribing pathway is complex. It is adaptable. It's adoptable in many different ways. Essentially, then the individual participates in the activity, whether that is taking a music class, visiting a museum, going to a self-help group, and then meets again with that link worker or community navigator to assess how that's worked for them. Then the individual is able to make adjustmts with the navigator to what would be most suitable for them to continue. And then it is followed up with their primary care physician. So right now, the different parts of the pathway are being looked at, and also looking at how we can connect this to formalized care in terms of electronic medical records, and how different sectors can speak to each other in terms of data collection and data sharing. I was going to say, you can, if you scan the QR code, you can go to the Canadian Institute for Social Prescribing website where you can find more information. In relation to post-secondary settings and student mental health, colleagues, Davis and his colleagues looked at how one could advance and enhance student well-being through social prescribing through a realist review to come up with a theory model for what would be important for a post-secondary setting. And they found 4 things. First is an accessible gateway, so providing services that are both physically and virtually available to students. The flexibility would be necessary to reduce stigma, especially for students who may find engaging in-person services to be highly problematic. And then integrating social prescribing pathways with ongoing initiatives and supports within that campus setting. Then they point to the skill peer. And so I spoke about the link worker or the community navigator. The skill peer was identified as the individual that could help students figure out what was meaningful for them, what they could access in terms of what was available on campus, what was available off campus. It was a peer-to-peer model. And they also noted that in order to do this, there required to be significant scaffolding and training and support for that peer skilled worker to be embedded within health centers or wellness centers. The third item in this theory was a trusted, safe, credible source. So imagine you're a student, you're looking for mental health services. You may go to your university or college website, and you find an array of available programs, initiatives, resources available. You don't know where to start, how to start, and what to access. There are a lot of resources available online, and so the review pointed to a need for curated and validated opinions or options available for students that would be curated with the Health and Wellness Center, as well as with these embedded skill peers. Expanding these resources not just within the university setting, but also creating broader support networks, to community resources, community initiatives, and building those partnerships to increase those linkages and social capital between the university and the communities in which the universities reside. And then the last point or bracket was a healthy setting. So using a settings-based approach, which connects to this idea of holistic upstream and I guess health promotion that's rooted in embedding health, not just within the health sector, but looking at the whole institution and strengthening the institution operations to provide that path for students to approach multiple different resources and services, from financial aid to housing to food security, and strengthening those campus ties with the different groups on campus, but then also expanding that support off campus. So this was just some of the initial findings from that theoretical model that they found. And what that means now is, how can we take this model and look at the feasibility of implementing social prescribing within post-secondary settings? So here I'm just going to briefly describe a new project that we are initiating at the University of Toronto. On the team are Kate Mulligan, Kristen Cleverly, my colleague Dan Hayes, Chris Bartha, and Caitlin Mull. And what we're doing is trying to understand how social prescribing pathways could look on a campus, on different campuses. So U of T presents a perfect structured case study. It has 3 campuses, University of Toronto Scarborough campus, University of Toronto Mississauga, and St. George. Each of the campuses are quite different in the student body, in the types of campuses they are, commuter campus versus residential or an urban campus, and the types of services available, whether it is consolidated within one center or sprawled out through different locations in an urban context. It also allows us to look at how different settings are incorporating different frameworks for health promotion, and how these frameworks can then be integrated with this pathway model. So we have 2 main objectives of this study. One is to assess the awareness and perception of social prescribing. This is the new term. As I said, what I described may already be happening in multiple different settings. It just may not be known as social prescribing. We want to know what students think about this idea of social prescribing, what health and wellness staff think about it, and what university administrators think about social prescribing. The second objective is then to identify, using the theoretical frame, the key elements of the pathway and what that could look like across these different settings, and how that pathway can be potentially integrated based on the context in which it is integrated across these different campus settings. So looking at the study approach and methods, this is a structured case study. We're looking at a feasibility of even implementing a social prescribing pathway. Is this something that is feasible? Is this something that is needed or wanted across different settings? We're using design thinking principles to approach this. So looking at what this means in terms of how it could work from the different inputs of stakeholders, and how we can get an uptake of getting this sort of data from the stakeholders identified, using a mixed methods approach. So we're going to be using both qualitative and quantitative data, interviews and focus groups with students, with staff members, with administrators, and then conducting surveys to evaluate awareness. So Dan was going to speak a little bit more about that aspect of just the awareness and perspectives of social prescribing, and then how that can be integrated to building and putting together this pathway. We're going to be working closely with a student advisory group made up of students at different levels of studies, from undergraduate to graduate, and experiences international students across the 3 campuses, to give us insight on how to advise and build this pathway that are responsive to student needs at each of these campuses. And we're hoping that through building this case and looking at the pathway model at U of T, this would give us data to be able to pilot social prescribing across post-secondary settings in future studies. So I will end there, and I'll pass my mic on to Dan, who is going to give you a little bit more insight on exactly the first part of that. What are some of the perspectives coming from students on how they feel about social prescribing?
Is that okay? Okay, I'll assume so until I
Yes,
hear
we can
anything
see it.
else.
Thank you.
Perfect. So I just wanted to give you a tiny bit of background before we get to the kind of social prescribing with higher education students. So from a UK perspective, social prescribing originated in primary care. And what I mean by that is it was rolled out at family doctors and GP surgeries. So kind of the first point of contact most individuals have with the health system from a UK perspective. The problem with that is that we know that young people and young adults don't really access primary care and GPs in the same way that adults and older adults do. And they're much less likely to attend GP appointments for their health and well-being, or mental health and well-being. And this differs quite a lot, with older adults tending to go and see their GPs more for aspects such as loneliness and social isolation, which is where social prescribing in the UK originated from. So we know that social prescribing can't or doesn't work quite in the same way. And despite there being interest from young people and young adults, the uptake from primary care has been lower. So really trying to figure out why has been kind of a critical piece of this puzzle for us. And what we're also finding, and I can send the link through for the paper, is that link workers, when they're not based in primary care, are more likely to be accessing these underserved populations, really highlighting the need for social prescribing to be placed in the right area and locations if it is to work with young people and young adults. I won't dwell on this too long because I'm aware of the talk being in older older kind of student populations as opposed to those in primary and secondary school. However, we did start our work with this in looking at how social prescribing can be used to improve loneliness for young people in primary and secondary school. And currently that work is underway. We've developed social prescribing pathways for young people in primary and secondary school as a way of addressing loneliness. And that's currently being rolled out and evaluated. And what we found so far, although ongoing, is that it's been accepted and found suitable and acceptable in these settings, and therefore this paves or paints a really potential positive picture for how social prescribing could then be applied in other educational settings such as post-secondary and higher education institutions. Most of my work has been with slightly younger individuals, but I just wanted to give you a case study of an individual that we have been working with, which would kind of fit on the slightly older age range. This was a young person who was 17 and had severe social anxiety and wasn't leaving the house without a family member. On the referral form, we found that they used to be quite a talented athlete with regards to football and rugby, or soccer, if you call it like that in Canada. But they'd subsequently stopped doing those activities and were very much housebound. We did remote social prescribing with this young person as they weren't really ready to leave the house. So the link worker met with this young person over Teams or Zoom to discuss their needs. And it further transpired that this young person had left school at 16 without any qualifications and they were struggling to find work. And due to their severe social anxiety, they had stopped training and competing and found team environments challenging. The initial session, so very much as Nicole outlined, kind of what matters to you, was really focused around kind of sports and their related dreams and ambitions related to sports and getting more positive experiences and better engaged with sports as a longer term goal for them. After some work with the social prescriber, they decided to return to training and actually ended up attending rugby and football trials to see what they could do longer term and get back involved. There was a growing focus on experiences of school and the need for kind of further learning and support, and this wasn't really provided to them as they left school early and weren't able to engage. Following this, the social prescriber began to independently research sports and training programs and education programs to get them further engaged. And they then identified a free employment mentoring program for this young person for those not involved in education, employment, or training. Subsequently, they then decided to enroll at college, accompanied by the social prescriber and parent. So just really wanted to highlight the potential impact of social prescribing when applied properly, and the applications of this to higher education or post-secondary setting are quite apparent. The main thing I wanted to talk to you today, which Nicole highlighted in her slides, is kind of the applications to social prescribing in post-secondary or higher education settings. I won't go into some of these details because Nicole has covered them already, but whilst it can be an exciting time, some of the stats around this paint quite a bleak picture for student mental health and well-being. A Better Health survey in 2023 found that 92% of students experience loneliness often, and that actually around 35% of students report symptoms indicative of mental health difficulties within their first year at university, which is substantially higher than the average population. We also know that access to different types of support within education establishments is not kind of universal, and that there's some individuals that may access or find it easier to access these services than others, and this could be due to them coming from a different environment or country and it not being familiar to them, or some stigma attached to going to specific services. We also know that such services are quite fragmented. In the UK, at least, it's not a very joined up system. So where you can get help for counselling versus student services versus financial support and help is all over the place. And particularly when it's not based in one campus, can be particularly challenging for the students involved. And a recent review by Osborne in 2022 found that there was a substantial variation in students using mental health services, and findings from the review indicated that services probably weren't currently meeting the needs of students, often due to them being quite disparate. We are in the process, and this is an ongoing survey at the moment, so these results may change a tiny bit, looking at the role of social and community support for post-secondary students, university students, focusing on mental health, well-being, and social prescribing. Currently, we're on around 700 students in the UK that have completed. And it's quite varied across the UK, and this runs from undergraduate all the way through to PhD. So we've got quite a spread. If social prescribing is to address some of the social determinants of health, as highlighted by Nicole in her earlier slides, what we're finding from a UK perspective is that currently 18% of students in this survey are reporting that they have inadequate heating. And we know that such aspects are precursors potentially to exacerbating or perpetuating mental health difficulties. Half of students involved in this survey were always or often worried about food running out, and 35% of students worry that they don't have enough money for their bills. So in terms of addressing these underlying causes which impact on mental health, some of these stats are quite shocking. We also have seen that mental health is impacting on their education. So nearly a third of students report missing university due to their mental health. And of those that report missing days, it's an average of just under 7 days. So a week's worth of university being missed in the last 6 months because of mental health and well-being. Taking this forward, though, and looking at the role of social prescribing, there are some interesting findings which I think pave the way for Nicole's study particularly well. So one is that whether students have heard of social prescribing. Currently, only 25% of students that we've surveyed have heard of social prescribing. So this very much speaks of a need or a lack of knowledge, which can be easily addressed by putting social prescribing in places where it's more visible and acceptable. In terms of whether students think that social prescribing can help with mental health being, overwhelmingly 97% said yes. And interestingly, almost similar percentage think that universities should be offering social prescribing. So 95% said yes. And of those that were surveyed, 89 said that if they were referred to social prescribing by a healthcare professional, they would take it up. Slightly more tangentially, but potentially relevant in terms of embedding social prescribing in university settings, is that 93% of individuals thought that social prescribing is relevant for healthcare professionals, and of those, 87% think it should be incorporated into the health curriculum. So making sure that doctors, nurses, pharmacists, psychologists are aware of social prescribing. So overwhelmingly a positive picture when it comes to potentially embedding social prescribing and its role within student mental health. However, a slightly less rosy picture when we think about the impact of mental health on education, as well as the impact, as well as how the social determinants of health may be impacting on these mental health difficulties. That's just a brief update from me. Le-Tien, I will pass back to you.